On this episode of the Big Insurance Connect, I had the pleasure of speaking with Carla. She's an expert in the diabetic testing supply space for ADS, and we took a deep dive into everything you need to know. So if you or a loved one are diabetic, you really cannot afford to miss this information. Let's check it out. I'm so glad that we're having you on today. I met you at the Miss Medicare conference in Ohio this year, and just the resources alone, I was blown away. And for anyone that is literally having to deal with, ordering or going through the whole process of getting any diabetic testing supplies or, any kind of DME that goes with, testing yourself. Oh my gosh. As an agent, I need you. And I just
so valuable.
That. I love that.
I love it.
I love that. So just for, because this is going on my YouTube channel, the audience, for the people who may not really be that familiar with it, but tell me, what exactly is ADS?
So ADS, we've been in the industry of Medicare for over 20 years. So ADS stands for Advanced Diabetes Supply. And what we do is we're basically providing a personalized service to these members who much need their testing supplies for diabetes.
Right,
could be their meter and strips, could be their Freestyle Libre, the new technology under Medicare that's now super exciting and helping our members live a better life. We provide a support and partnership with our agents to be able to provide this really cool service and for their clients and members.
That is amazing. And what really blew my mind is the fact you're like, oh, it doesn't cost anything. This is like a service that's provided to you for your clients. And I was like, what? Okay, wait a minute. So does this work? Like if I had a client that really needed your assistance to get it with their supplies for testing, are you everywhere? Is this all 50 states? Tell me like how.
Great question. Yeah, absolutely. We're nationwide now. My point of connection to support these members is Florida, Georgia, and Alabama. But I do have a whole team who supports members nationwide. But, we touch base on something super important. Our seniors, we're focused on Medicare, but now we're helping members all over the broad, because now we help with ACA plans, we help with group plans, MedSub. And what we found out in regards to testing supplies, how they're billed, is our members are getting copays in error. So not only we have a service that is cost you nothing, because we do it for, to be of service to our members, but also we're making sure that their testing supplies are billed properly.
I love that.
Right? We want to aim to get our members covered 100% if we can. We are thrilled when we can. But of course, we're billing the supplies properly so these members are not paying extra money when they don't have to.
Right. And, I think that's amazing, because I do get a lot of people who just, they don't understand their plan sometimes when it comes to certain parts of, the parts that they don't have to use that much. Of course, in this case, there are certain carriers and plans that are really kind of like speak more to their diabetic needs and things of that nature. But I just love the fact that you're an additional resource, like some reinforcement, just because it's even busy, like so busy during the annual enrollment period, where we're running into people and getting a lot of questions. And I feel like you're like a place that I could field some of those questions to. And one, because I don't like to give out information that I don't know the answer. So you're an expert in this, where I am more of, a liaison for you. So I'm excited. So I want to get into this presentation that you got here. So we're going to go ahead and add your presentation to the screen, and you can take over. But I'm excited about what you have to say about the diabetic testing supplies. This is amazing. There's so many people that are dealing with this chronic, condition.
Very, very true. Yeah, so I'm going to kind of go over in slides so everybody can have a visual of how ADS support members and kind of have an idea what ADS is and so forth. So let's start jumping off. What is ADS, right? ADS is a diabetes supply pharmacy and concierge diabetes supply pharmacy and service. So we do the service and the pharmacy part, providing our members not only their testing supplies, but like you mentioned, we're providing an educational call so these members understand what they're covered for and what they qualify for, which they would not know going to a local pharmacy, for example, right? So we've been in business for over 20 years. I consider myself and my team on-call diabetes expert for our members.
I love that.
As we can see here in the graph, the diabetes, it is a growing concern. It's growing by the minute. As you can see here in the chart, it's getting darker blue. Unfortunately, it is the reality of our nation. We have a lot of members who does have diabetes. So I would say 1 in 3 Medicare beneficiaries have this condition, I could say. So we can help you. So you can have an understanding that the data doesn't lie, right?
Right.
So what is, diabetes? For some people, they don't understand diabetes. So diabetes is a long-term condition that causes a person's blood sugar, the glucose levels, to become too high. So the hormones of the insulin produced by the pancreas is responsible of controlling the amount of glucose on the blood. So we have the type 1 diabetes, which the pancreas is not produce any insulin, and we have the type 2, which the pancreas doesn't produce enough. So it does produce, but not enough of the insulin that is needed to regulate the blood sugars in the body. So it's kind of nice to understand what diabetes is, the symptoms of it, complications of it, because not only diabetes is really icky to live with, but also can opt to more chronic illness like heart conditions and so forth. And so we, ADS, help our members on the phase of prevention and management. So not only our members are living a better life, we're saving lives with this new technology that's now available for them.
Wow.
Mm-hmm. So basically, kind of understanding how can ADS help. Again, I talked about a personalized service that's tailored to members with diabetes, on the go diabetes experts who are available for you for when you have questions. We help members take full advantage of their new benefits under the new plan, which a lot of them do not know about. They're qualified for the Freestyle Libre, for example, and ADS does all the work behind the scenes. So we work with the doctor's office. We do all the meeting and greeting behind the scenes. And
do you know what? Mm-hmm. I needed you like 5 months ago. I can just right now in my mind remember one client that sticks out in my head that changed to a new primary care doctor. Mm-hmm. And there was order after order after series of DME providers that they had to go through with the carrier, customer service. I don't know how much time I really spent on that. Literally, it almost cost the client like to want to go back and change to a different plan, because he kind of put in his mind that it was the plan that wasn't working, but it probably was the process that wasn't working.
Exactly. It's usually the process in place.
I'll just go back to my old doctor and go back to my old plan, and I won't have this problem anymore. But it was really for that one Libre machine. I cannot believe that people are experiencing this on a daily basis. So you are, I don't want to interrupt you no more, but I just wanted to tell you that like that is serious. This is a serious situation for some people.
Absolutely. And that's one of the major calls that I get from agents to me is, please help my client. If their client's calling me, they're stressed out, they have gone to many places, and I just say, take a breath. Let's start over. Let me help you. You don't have to do anything. Let me get all this together for you and get your Freestyle Libre that you much need. So one of the things that they're looking for is their testing supplies to be properly covered, right? Mm-hmm. And that's one of the biggest things for us that's really important for our members. So this is exactly what we provide, like work-wise behind the scenes. That is a lot of work, a lot of time consuming, right? We work with the doctor's office, get the prescription in. We work on the pre-authorization that's required now for almost all plans. We do the verification of the insurance plan and bill those supplies properly, so our members don't have to pay for for much. We're hoping for zero copay at the end of the day. And what we do too is we provide the supplies shipped directly to the client's home, right? The member's home, with free shipping and with UPS.
I love that.
Yeah. So talking about the hardware part of the diabetes management, here is the blood glucose meters that's covered under Medicare, right? We're kind of focused on Medicare right here. And these are called the BGMs, the blood glucose meters. We have the One Touch and we have the Accu-Check, different models, but same, those two brand names. These are covered under Part B as Bravo. There's a lot of confusion on dealing with like how to build the supplies. Part B is where these supplies are billed through. And most always is zero copays, right?
Right.
And here's the new exciting new technology that clients are looking at the commercials or wondering what it is. They're asking their agents about it. And these are the sensors that goes on the arm, in the back of the arm. And what they do is they take away the pricking your fingers every single day. So no more pricking your fingers. You now can use a sensor with the Dexcom G6 or the G7. And we also have the Freestyle Libre 2 and 3. And yeah, the cost varies under different plans, but we try our best to get zero copay for our members.
Okay, can I ask you something real quick about that? Yeah. If someone is receiving Medicaid and Medicare under a dual plan, does that help? Can you help them?
Absolutely. Yeah. They're covered 100% with Medicaid. They also, because these are Part B items, they're covered 100% with MedSup plans, supplemental plans, right? And when they go to the pharmacy, for example, they don't know how to bill supplemental plans. They're so trained to work with medication, they forget how to properly build these supplies with the supplemental plan, and they get denied or they get copays in error, which I hear that every day.
Oh my goodness.
Yeah. And so this new technology, the Libre and the Dexcom, you can share data with the doctor's office. You can share data with the family members. We have about 30% of our members have hypoglycemia, which is low sugar readings at 54, 58, around that range. And if it gets low enough, the member falls down, they faint, and they can hurt themselves. So there's alerts when it goes really down to that number. And so family members can check in with their loved ones. And it's a saving life technology.
Wow.
Here's the insulin pumps and those supplies. So for a new pump under Medicare, their copays were usually seen at 20% copay across all carriers. So every carrier will bill kind of the same way. 80% coverage, 20% copay for the member versus ability. And these are covered under Part B. But if the member has the insulin pump already, we only provide the supplies for that pump. Those are covered 100% under Part B.
Gotcha.
Here's a quick look on how the sensor in an insulin pump works. Here is the Libre 2 Plus sensors, which is brand new for 2024. The Libre now is compatible with most insulin pumps. This one is a t:slim. X2 is a Tandem brand. Isn't that cool? No more sticking your fingers every day and no more daily injections.
Yeah, that's amazing.
I know. Such a good quality of life now for our diabetic members. So
real quick before you go to the next slide, if someone is traditionally pricking themselves still right now and they want this particular device, do they just ask their primary care for a new prescription or some kind of an order? I mean, how does that process start?
Great question. For the new technology to be covered, well, one, they have to go through the doctor's office. We will fax the doctor on our side and let them know, hey, your patient wants to get the Freestyle Libre 3. They will fill out the form, which is the prescription pretty much, and they fax us back. So we work directly. We have a team that works directly with the doctor's office. So they're really well known who ADS is. And there is qualification under Medicare. Okay. The two qualifications would be, one, the member is injecting insulin one time a day, not 3 times a day, just 1 time a day. Or if the member is not injecting insulin, which happens a lot, well, 30% of my members have hypoglycemia. If they have those low sugar readings, they're qualified under Medicare for coverage, right? The keyword is coverage.
Okay, that sounds great. I like that. Thank you.
Of course. Here's a new product as well that is the Tandem Mobi system. Is a Part B item. Just came out about 3 months ago. We're dispensing it now. It's the smallest DME insulin pump in the market. It's super cool. You can hide it. As you can see here, the pump will go into a little sleeve, a white sleeve, and has the infusion little sets because they wanted to keep it as a Part B item, not a Part D. And I'm going to go over a Part D insulin pump, which is really popular, but can get really pricey after, getting to the donut hole, as we can say it.
Right.
And here is the Part D items under Medicare. So the Omnipod, the 5, is very popular with our members. They love it. How can you not love it? So it's a little pod that goes onto your skin, on your arm, on your stomach area, and you use it up to 3 days, and then you toss it out.
Wow.
And that's why it's covered under Part D and not B as Bravo. So after 90-day supplies is dispensed, and the first coverage, co-pays for the first 90-day supplies would be a certain amount of money. Let's say ballpark it at $145,
right?
Which is a really great price for 90-day supplies for the Omnipod. And here what it looks like on the body. We actually have a lot of kids coming through us to get our support. So the Omnipod is compatible with the Dexcom G7. We're moving away from the G6 because it has a transmitter. Long story short, the Dexcom G7 is now compatible with the Omnipod, and this is how really what it looks like on the body. So you can use it on the arm, or you can use it in the stomach area. You can use it standalone with a little app, like that phone looking thing. It's really an app for the Omnipod. It comes together as a kit, or you can use as a closed loop system, like the Freestyle Libre and the Tandem, like I talked about. Same thing for the Omnipod and the Dexcom.
So this is more, children are able to get these same devices. Now, I do want to just go, you don't have to go back in the slide, but just also with the changes that are happening for 2025 with Medicare for the prescription drug, with the Inflation Reduction Act, do you feel like the Part D of the pumps, like the disposable pumps, are going to be covered under that, or we just don't know yet? But still, like, is that gonna fall into that $2,000 deductible situation? Yeah,
so that's what is the message, that now Part D medications and the Omnipod, which is covered under Part D, will go into that max of $2,000 for the year. So that would help tremendously. I have a member right now who is paying $1,200 for the Omnipod for 90-day supplies.
No, are you serious?
And he works, and he does, he's in a leadership position, so he has to hide his pump, and he doesn't have time to stop and inject himself, every day, 3 times a day. So he loves the Omnipod. He's willing to pay it. He's so excited about the next year. We can't wait to see how this coverage is going to impact Part D items like the Omnipod.
Right. That sounds good, though. Promising.
Promising. And so for Part D items, we actually we're seeing some copays for pen needles and alcohol wipes as part of the set, but pen needles. So for members that are injecting insulin with a syringe or a pen needle or a pen, the needles that goes with that, we can help with the copays for those. That's something that we do. We have a program in-house, and we can help out that way.
Okay. Man, this is amazing. I love that we connected on this.
Me too. Always happy to serve. All right. So how can we take advantage of ADS support right away? So members will be connected with a portal link. So I have actually a portal that's safe for members to go in. This is if you have a phone handy, you can actually scan it on the screen. The QR code will lead you to a form where you can fill out your information. Or you can call directly. This is my cell number, my work cell number, 760-519-1443. And here is also my team's phone number. And here's our little last page with your information and my information, teamwork, serving you.
Yeah, we also have the that same number for your team scrolling at the bottom of this video, just so that, if somebody wants to grab that information throughout the presentation, they can go ahead and just call. So that number is in Florida?
So that number is all nationwide. So the 8760, the area code is a California number, area code number, but the 760-827-6243 has been designed to call our members from that number and to receive calls from our members, because we're trying to get away from the scam calls and all the marketing calls that everybody receives, right? Our members are receiving 50 calls a day, right, and they don't know it's safe to answer our calls. So we're here to help them. And so we designed this, system where we can call from one specific number.
Oh, wow. I love that. So I'm going to go ahead and take this off right now, but we'll also make it available. And I just wanted to tell you that this is amazing, amazing resource, amazing information that you're sharing. I'm glad to be able to get it out so that, I know there's probably, if I just look at my own book of business, but then think of all the family members that we can help, all of the friends, even the children. I mean, honestly, when I met you, I wasn't even thinking on that level. I was just thinking Medicare. So I am so glad that we're going to be able to be a complete resource to, all ages, and also just get a little bit closer to making life a little bit more normal and less complicated when it comes to their insurance needs. So thank you so much for doing this today, Carla. You guys, until the next time, I love you and I mean it.
If you enjoyed this episode, do me a big, big favor. Please like, share, and subscribe to the #1 insurance resource that has you covered from the womb to the tomb for all things health and wealth. Until the next time, I love you and I mean it.